a lot of people in the field regard EEG maybe as a technique that can be very useful in epilepsy or in sleep disturbances or coma. And I think it has gotten a bit out of sight in dementia diagnostics and effect monitoring. And I think it is a bit underestimated in that sense. But I also have the feeling that at the moment you see that there's some increasing attention for it again, because when like with the larger phase 3 trials that we have seen last year, you saw that the removal of amyloid plaques, and that you can show with PET scanning, for example, well, that's of course makes it likely that your drug is also doing something beneficial to the brain. And likewise, I think people now starting to realize more that if you are able to show really an improvement of brain activity, that's a kind of an objective sign that something's improving. And of course, you still need to see if cognition and function is really improving along with that. But so I think road to implementation, I think the realization that EEG can be useful and is a relatively straightforward technique. It's also relatively cheap. It's patient friendly. So I don't see any large obstacles except for a bit more awareness about the fact that we still have this technique. It was used a lot in the early days when we had the choline esterase inhibitors when they were coming for Alzheimer's disease. That was more than 20 years ago, but they also really showed in the people who responded favorably, they also showed a reversal of these EEG rhythms. So it was already a sign that EEG is capable of showing good treatment effects, but it has gotten out of sight, I think, a bit because of the dominance of MRI and PET and CSF analysis. And I think EEG might be making a bit of a comeback there. What might be part of the reason that it has been a bit more out of sight is that the analysis of neurophysiological data does require. It's relatively technical and does require experienced staff and research crew. And there is the type of data is relatively variable. So if you look at MRI, you see more atrophy or you see less atrophy. Well, in brain dynamics, it's of course so enormously dynamic that there's a lot of variability. So you really need to know what you are looking for and ways to make your measures robust. And in the past, have seen also measures that did not perform well enough to be used as a marker. But I think the markers or the measures, the quantitative measures, they are improving. And of course, we're gaining more knowledge with them now that they're also being used more in trials. We gain more experience how well they actually perform.